Okay. All right. Question for you guys. How many here take Viagra? I knew you would. I knew that was going to happen. The fact is, I'm not really asking that question. I don't want to know who takes Viagra. The fact is that I'm asking this question because I want you to know that Viagra actually wasn't produced initially for what we know it for today. It was actually produced to regulate blood pressure. And what it did was it dilated blood vessels, causing your blood pressure to go down. So today, I don't want to talk about Viagra. I want to talk about blood pressure, and it's kind of hard to see. According to the American Heart Association, every 1 out of 3 American adults has high blood pressure. I worked in the emergency medical field and in the clinical medical field, and I've seen extreme cases from both sides. I've seen extremely high blood pressures. I've seen extremely low blood pressures. The fact is that we as humans, everybody sitting in this room has blood in their system, and you have some sort of pressure. Some of you may be dealing with high blood pressure right now. You may be on blood pressure medications. Some of you have loved ones that are on blood pressure medications. It's something that affects us all. I'm thoroughly convinced, though, that the more we know about blood pressure and the more we understand how it works within our bodies, the better we'll be able to regulate blood pressure. So there's a few things I want to talk about today. I want to talk about exactly what is a blood pressure and how it functions in our body. Secondly, I want to talk about how it affects you and what causes high or low blood pressure. And lastly, we're going to talk about just how to get a blood pressure and the process that you have to go through to get a blood pressure. So what is blood pressure? What exactly is it? Well, according to Mosby's Medical Dictionary 2008, it says this. The blood pressure is the pressure exerted by the circulating volume of blood on the walls of the arteries, the veins, and the chambers of the heart. It's a great definition. In medical terms, you'll hear 2 terms, hypertension and hypotension. Hypertension is basically what doctors would call high blood pressure. Hypotension is what doctors would call low blood pressure. Now, to really understand blood pressure, those are great terms. But to really understand, you have to get back to the heart of the issue. And the heart of the issue actually comes from the heart. The heart is a muscle within your body, and it contracts to pump blood to your blood vessels. So there's 4 chambers within the heart. You have the upper 2 chambers, which are the left and right atrium, and you have the bottom 2 chambers, which are the left and right ventricles. Now, these chambers have jobs, and they also have names to the jobs. So the ventricles, the bottom chambers, what they do is they contract and pump blood to the vessels, like I stated. Well, that's called systole. And then when the atrium, what they do is they contract and they pump blood into the ventricles. That's called diastole. And I say that because a lot of us are familiar with the numbers, the blood pressure numbers. And if we're talking about systole, we're talking about the top number of a blood pressure. So let's say you have a 140/90 blood pressure. Well, your systolic number would be 140. The bottom number would be your diastolic number. But since we're bringing up numbers, what's a good blood pressure number to have? A lot of doctors would say the perfect blood pressure would be 120/80. Some say, a little bit lower than that. But the fact is, anywhere around that, you're doing pretty good. Now, as far as high blood pressure, you're probably pushing the limit once you start getting into the 140s over, let's say, 90s. And you're really pushing the limit if you're a 160 plus over about 100. So if you're in that area, you might want to go get it checked out. Just go in and have an exam. Not really hard to do. Call your doc up and he'll be happy, or he or she will be happy to do it. Excuse me. So how does blood pressure affect our lives? Or what causes high or low blood pressure in our lives? Talking about low blood pressure, hypotension. How many females have been pregnant in this room? None? Okay. Well, a pregnant female's blood pressure drops 10 to 15% of normal because they have a hormone in their body called relaxin. And what that does is it helps them through the process of pregnancy. There's certain medications that cause hypotension. Medications such as beta blockers, diuretics, which take the fluid out of our blood system. A few other things that cause hypotension: severe blood loss, which is obvious. If you have any type of dehydration, causes high blood pressure or low blood pressure. Now, on the flip side, high blood pressure, there's a lot of things that cause it. A poor diet, high cholesterol diet, high fatty food diet. Stress causes high blood pressure. Smoking causes high blood pressure because nicotine in cigarettes is a vasoconstrictor, and it causes your arteries to constrict and doesn't allow the blood flow to your body like a normal person. So the one thing that you want to do if you do have high or low blood pressure is get it checked. And the way that you do that, you go down to the local doctor, get it checked, or you can go down to Walmart, you can go down to Walgreens. But when I worked for the fire department, we had people come in and we check blood pressures all the time. And how we did this is we just used a blood pressure cuff, a stethoscope, and we'd wrap the blood pressure cuff around their arm, covering their brachial artery, put the stethoscope right below the blood pressure cuff, and listen. We'd pump it up, and we listen for the first heartbeat. That first heartbeat would be the systolic number. Then when the heartbeats would stop or they would cease, that would be your diastolic number. So today we've talked about what blood pressure is, we talked about how it affects our bodies, we talked about how to achieve a blood pressure or get a blood pressure, and we talked about some numbers. So I'm going to reiterate, the more a person knows about blood pressure and the impact it has on their day-to-day health, the better they will be able to regulate it and enhance their health. So in closing, just think of low blood pressure as being the Grand Canyon in the spirit of summer vacation, and high blood pressure being similar to Old Faithful.